Hi, I'm Jason,
And I'm Jim,
and we're both paramedics.
and we're both old paramedics.
Yeah, we've outlasted a lot of our colleagues, and the biggest thing we're going to talk about today is what if you want to become a paramedic and what's going on,
Sure.
right?
Yeah. So how did we start off down our path to this type of a career?
It's a,
First,
it's a good career,
it's a good
right?
career. Yeah.
Right, but we're also in Alberta, Canada. So if anybody else is watching it, the problem with paramedicine and EMT and EMR kind of thing is that every province and even when you go through the United States, it's all a little different.
Every province, every state has its own take on it. In Canada, we have a broad, overarching competency profile for paramedics that's put out by the Paramedic Association of Canada, and all the schools follow that, but it only gives you your um, baseline educational level. In each province can add or change bit depending
Yeah,
on their unique geography and their
yeah.
demographic for people.
And the scopes change per ever. But the biggest thing is that if you want to become a paramedic in Alberta, you have to know a few things. First of all, you just don't become a paramedic.
Yep.
There's different levels of paramedicine. So in Alberta, we have EMRs, primary care paramedics, and advanced care paramedics. And both Jim and I are advanced care paramedics. So the biggest thing is that as we get into this, we're going to be looking at EMR. We're going to start right there.
Mm-hmm.
That's the first level entry to practice. So there's a few things we're going to tell you about EMR. EMR is basically, I don't like saying advanced first aider, but it is actually once you become an EMR, you actually are now a professional um, practice, so that you have to meet to a certain standard. So there's a few things you need to have is that just because you went to school, you still need to write a provincial exam or a registry exam to be registered within Alberta. You also need to carry malpractice insurance. And that's why I bring up the malpractice insurance is
Mm-hmm.
where it proves that you are now a professional.
Professional. You're responsible for your own practice with the malpractice insurance. Um, and yeah, that's kind of where it starts.
So how long does it take to become an EMR?
Somewhere between 8 to 12 weeks, and it depends. There's some shorter programs and some longer programs. It really depends on what your ability to put in the time is for that.
Yeah. So basically, when we start looking at it, um, there's a lot of different schools. A lot of questions I get asked is, "What's the best school to go to?" But the problem with that is that
There isn't a best school.
yeah, it's what best fits your life at that point.
Yeah.
If you so like Nate has a program that offers you go to school 2 days, 2 nights a week. So if you got to work, that might fit you. Or if you're somebody that really needs that hands-on drilled into you, there's ESA and I think PMA. They both have full-time courses where you go to school for a whole month. They're quicker
Quicker.
because you get it done faster. Where Nate, on the other hand, is you still can run your normal job if you got family, that kind of thing.
Yeah,
But again, it becomes a lot more work.
it totally does. So, and once it comes down to, and as well, whether you do a blended learning or a full-time learning course, there's many different types to fit your learning style and your lifestyle.
But before you jump into becoming EMR, let's say that you want to get some experience prior to that, or if you're not old enough, you
Mm-hmm.
can look at stuff like get your first aid with CPR.
Yeah.
And I'm going to promote a little bit of heart stroke here because this seems to be the what everybody wants you to have when you get into this industry. The other thing you can do is make sure that you have a Bio 30.
Yeah.
So if you're still in high school, make sure you take that Bio 30 because you need that as an entrance to practice into to actually get accepted into EMR, PCP, and ACP. The other thing you can do though is if you do get that first aid, you can look at stuff like there's places like St. John's where you can volunteer and do some advanced standby, which will give you some idea what you're doing. The other thing you do is become a lifeguard.
Become a lifeguard.
Yeah, at 16, you can get your lifeguard, start practicing as lifeguard. You'll get used to doing scenarios, that first aid, you become that first responder. You'll understand some of the responsibility that comes with it as well.
And you get involved in some patient contact as well. I mean, you're dealing
Yeah,
with people, patient contact, which will help as you go through your career.
90% of the job is talking to people.
90% of the job is
Yeah, it's
talking to
more of the thing.
people.
The other 5% would be holding hands, and the other 5% is where you're actually going to do the sexy stuff,
Yeah,
right?
do the hardcore work.
So some of the things that the next level is primary care paramedic. So again, it's the same thing, but the thing of the primary care paramedic is about I don't know, honestly, I think it's about an 8-month course. Depends on where you go. Some schools are a little longer, some are compressed to get you in and out faster.
Mm-hmm.
And again, which is the best school? And I think really what the best school is what's going to fit your lifestyle at that time.
Because by the time you get through EMR and you're heading into PCP, you're making some adult decisions, you're adulting, and you have responsibilities. So what's going to fit within your scope of responsibilities, and that's the school you would choose.
So as a primary care paramedic, though, what you're wondering is what's their scope of practice, or what's the difference between that and EMR? Well, you now have pharmaceuticals that you're responsible for. So the
More medications.
responsibility is really becomes a lot more.
Your scope of practice increases. EMRs may give intramuscular injection for naloxone and epinephrine. Now, PCPs can initiate intravenous therapy and give some IV medications that you'll be responsible for.
Yeah, so you're also looking at like too, they can give Ventolin for people who have asthma attacks. So there's that whole extra piece of responsibility. Really, the jump is, like I said, my son just went through it. Somebody asked him, what's the difference between being an EMR and a PCP? He goes, I didn't feel a lot different now. I just have more responsibility.
More responsibility. Well, airway management becomes a big piece of it. Airway management in the EMR involves helping ventilate somebody. Airway management is the PCP level becomes using more invasive adjuncts to maintain a more patent airway.
And you're also now becoming more responsible in the sense of that if you look at high performance CPR that came out of Seattle, right, from the Resuscitation Academy, they truly believe that BLS owns CPR. So the idea that really good CPR is the foundation of the BLS crew. If you're an ALS crew like Jim and I would be, we actually come in and work around them. The other thing too, responsibility wise, is that airway, is that they should be able to manage the airway at a BLS level really well. Because as an ACP, if I show up and we're working on somebody that's super sick, or if we're going to have to intubate, there's a lot of math I'm going to have to do.
Yeah.
And if I got to do a lot of math, I can't be focused on other things that should be the responsibility of the primary care paramedics. So it is a big jump going from EMR. And when you're talking about like jobs, what's available, right? Like, so there's more jobs available for PCPs than there is EMRs. And then we talk about advanced care paramedics.
Yeah.
So
and going back to the EMRs, the bulk of the workforce across Canada, and I'm gonna go out on a limb and say probably even across North America, is our primary care paramedic level. They are our largest number of practitioners in the active practitioners within Alberta, and probably that holds true for the rest of Canada. The EMRs, they're limited in emergency ambulance. They can work emergency ambulance, but they usually find themselves in IFT. PCPs, bulk of the emergency ground ambulance workforce, and then ACPs.
Yeah, and ACPs, when we're looking at the ACPs for school, it's the same thing. A lot of places now have the blended learning. I've actually heard there's actually schools like, and I could be totally wrong with this Nate thing, that you can actually show up to class when you want, because they actually do it all online. They have this virtual setup since COVID. So you actually sign up, you show up, but you, depending on what's happening that day, if it's not like a true lab, you can actually watch the instructor do it from your Zoom or whatever they're using, Teams at the time. But it's way more advanced. It's a 2-year program. You have way more pharmaceuticals. You have way more electricity you can deal with. Again, you're looking at doing 12 leads, diagnosing MIs in the field. Where you look at the PCPs, they do rhythm recognition. They know how to put on the 12 lead, but the difference is that the ACP needs to be able to interpret it and knows what's there to give next. If you're in Alberta, we actually give thrombolytics. So that's also important to understand. That kind of, we just don't make that decision on our own. We actually have to send the 12 lead in and talk to a cardiac doc.
We cooperate with the broader medical community all the way through. Like Jason says, fibrinolytics. It's a high risk maneuver. We're gonna consult with a cardiologist and make the decision together that this patient will benefit from.
And the scope is so wide that there's a lot of different positions that, as advanced care paramedic, we got clinics up north where you work in there, and again, like I said, you're working along with other what do you call it? Yeah, the joint decision making with other physicians that are actually on the phone that you can get a hold of, and you're making decisions on whether you're going to give antibiotics, what kind of treatment they are. If they're sick enough, you might be in that clinic all night waiting for a advanced care paramedic to fly in and pick them up and take them out. If you're working in, like, say, a metro setting, we also have community care paramedics, right? Advanced care paramedics, and they go around and they'll work with that, trying to keep people basically in their home. And they'll be giving them different antibiotics. And then we have some cool stuff like TAMs, right? Tactical medics that work with the tactical team. Most of them are ACPs, but they do have some PCPs that do it depending on where you work. And then again, we have IRP medics, which are the incident response. They're extra trained in the sense of that they'll deal with nerve gas, that kind of stuff. Like, again, it's the more of the sexy stuff that they're doing, but it's really still only maybe 5% of the work that we do. So those are the different types of how to go to school, where to get your schooling from, how to get, we're really not talking about all the jobs are different, but it's actually a pretty big scope of what you can do when you're finished. And even as EMR is like the level entry, and you can get your feet wet and decide if you really want to do this job. Because it is, even though we're old paramedics, a lot of people don't last in the industry as long as we do. So that's all we got to say about that for today. Hey?
Yeah, I think so.
Yeah, we're going to come back and maybe talk about some coffee, though, because we do like coffee. That's how we've lasted this long.
That's how we lasted this long. Caffeine and rage.
All right, so we'll see you in the next one.